with the data which was available for Korea, Indonesia, Thailand, all these Asian countries, but we knew that something big was coming and it was going to hit us, and we had to be prepared to handle the cases if they land up in our country.
Sooner or later we knew that respiratory virus is difficult to contain. The main important task was that how to check that entry to a substantial time, and that particular time was definitely a race against time.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend. There are now...
A health crisis broke out during China's busiest traveling season, with millions visiting their families for Lunar New Year. It was to mark the beginning of an outbreak of a highly contagious virus. India was soon going to be under siege, and the race against time was to save those who would soon be at the heart of this emergency. It was as if Pandora's box had been opened, unleashing disaster, fear, and illness. The National Center for Disease Control, the national focal point for international health regulations, or IHR, sensed the impending danger. Immediately on 8th January 2020, multi-stakeholder discussions are convened. Different departments including Animal Husbandry, Wildlife Division, Ministry of Environment and Climate Change, Food Safety and Standards Authority of India, International Health Division, Zoonosis Division, Indian Council of Medical Research, Emergency Medical Relief Division, and World Health Organization attend the series of meetings. On 17th January, a joint monitoring group was constituted under the Director General of Health Services. Crucial decisions were taken. This disease had to be kept at bay.
In one of the earliest meetings that was done at NCDC, which NCDC had organized with all the health partners, there was a very clear strategic direction from NCDC that we needed to come up with communication materials that could serve the purpose of informing all those travelers who were coming from China, because at that point China was the the main source of the pandemic.
Based on the previous outbreak experiences like H1N1 and Ebola, thermal screenings begin for the international travelers from China at designated airports of Delhi, Mumbai and Kolkata. The surveillance at points of entry is elaborate. Guidelines are developed by NCDC, the Standard Operating Procedures, or SOPs, for airport health organizations to adhere to, for consistent responses from travelers and accuracy of information. Travelers need to fill in self-reporting health cards. Passengers are advised to be on home quarantine for 28 days. The protocols were laid. Once the airport health organization screens the passengers with thermal testing, passengers who are symptomatic were isolated and asked to don a PPE. The custom clearances are expedited and the passenger is escorted out of the airport toward a waiting ambulance. The passenger is then directed to the transit quarantine facilities. Initially, the facility was developed for 10 travelers, post which they would be transferred to the designated hospitals and released based on discharge policy. The susceptible group with symptoms are also sent to dedicated hospitals for further screening. At the same time, for those passengers who are asymptomatic in the initial screening would be tracked by the IDSP. The Integrated Disease Surveillance Program is mandated to strengthen disease surveillance in the country by establishing a decentralized, state-based surveillance system for epidemic-prone diseases. IDSP enables early warning signals for effective public health actions. IDSP shares the passenger details with the State Surveillance Unit and further down to the District Surveillance Unit, who would follow up with the passengers on their health periodically. As cases soar, NCDC, WHO, and UNICEF officials scramble to prepare and print IEC materials overnight.
When it came to India, it's not like caused by surprise. We have already been anticipating for some weeks that is sooner or later will be, because due to the amount of passengers and people who are interacting with China, Wuhan. We contacted International Health Regulation Secretariat of India in order to obtain these as per IHR recommendation.
We prepared the guidelines that at airport what information to be collected. Then for community surveillance, we prepared the guidelines that once these people go to the community, how we are going to do the surveillance. Then they were put in quarantine. So quarantine facility, we not only help the various agencies in preparing quarantine facilities, we also trained them, and our officers were on regular duty to them that to support the quarantine measures.
We had discussions around the messaging. We had discussions around the format of the materials. We had a discussion on the service promotion. We had a number of the discussions, and I would say that these materials has been developed as a great teamwork.
Directions were given to all concerned on surveillance, infection prevention, laboratory diagnosis, and control and risk communication. Guidelines are shared by NCDC with all the frontline workers on how to collect samples, how to package and transport them. All this is important in order to contain any infection from the samples. January 2020, a total of 43 flights with about 9,000 passengers coming from China to Delhi, Kolkata, Chennai, Bangalore, Hyderabad and Cochin are screened. With the developing situation across the world, it's important that NCDC activates the Strategic Public Health Emergency Operations Center, or PHEOC, to highest level of alert with 24/7 monitoring.
Information at that time was very crucial, especially during the initial parts of the pandemic when it entered India. So everybody wanted to know about everything which is happening to the initial few cases, including how they traveled, where did they land up, what were the initial symptoms. So that kind of information required a continuous, almost a real-time connect with the field level functionaries of IDSP.
Initially, the manual methodology was in the community. When the case comes positive, the case was interviewed and the contact list was manually typed, and the community, that is the ANM, auxiliary nurse midwife, used to go in the field and search for those contacts for any development of symptoms. But with the help of technology, even we can come to know the persons who may not be actually known to that confirmed positive case.
25th January 2020, NCDC call center number becomes operational. Initially with one line operational 24/7 in 2 shifts. On the same day, the Minister of Health and Family Welfare, Dr. Harsh Vardhan, reviews the preparedness to tackle the novel coronavirus. It is decided that central response teams led by the National Center for Disease Control would visit states and designated airports for reviewing the preparedness. Screenings are extended at 35 airports with designated hospitals. These hospitals, in advance, have been inspected by the Central Response Team comprising NCDC officers. 27th January 2020. Secretaries of various ministries attend the Cabinet Secretary meeting chaired by Rajiv Gauba on the issue. On 29th January, NCDC begins testing for COVID-19.
In the beginning, when we established the testing, 24/7 sample receiving facility, it was established at NCDC, so that we can receive the samples throughout the day, throughout the night, and healthcare facilities, those who are sending the samples, they don't face any problem.
The first confirmed case of novel coronavirus reported from Kerala.
On 30th of January, India marks his first coronavirus positive case. Reported from Kerala, the student was studying in Wuhan University in China, the global epicenter of the virus that was spreading its tentacles across the world. In fact, IDSP was already tracking the group of 40 students even before they landed on our soil. On the same day, the World Health Organization declares the outbreak a public health emergency of international concern.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
1st February 2020. With the heightened spread of the contagious virus coupled with fear and uncertainty, the government of India makes elaborate arrangements for the evacuation of 647 Indian citizens from Wuhan, China. By now, NCDC has developed a robust format for case-wise contact listing and follow-up. Universal screening has been extended for all flights from Singapore and Thailand, besides Hong Kong and China. This is India's first institutional quarantine centre, the ITBP Chhaula camp at Delhi's outskirt, Najafgarh. A team of 3 officers from NCDC, including a public health specialist and microbiologist, are deployed at the centre. The ITBP and NCDC officials review its preparedness. Medical staff and other frontline workers were trained on COVID-19 protocols and SOPs were put in place. Elaborate and intensive training was conducted to generate awareness on infection prevention control, like donning and doffing PPEs.
हम लोग का यहाँ पे ट्रेनिंग किया गया NCDC के थ्रू, सारी चीज़ें बताई गई, डॉक्टर्स ने भी हमें सपोर्ट किया, क्या क्या चीज़ें हैं सब चीज़ें बताया, PP किट वगैरह, बाकी सोशल डिस्टेंसिंग का ये सारी चीज़ें अच्छे से ट्रेनिंग किया गया. उसके बाद जो हमारा एक फोबिया था, डर था, वो हमारा चला.
Prepared to house over 600 returnees, this centre is an ideal location to set up a quarantine facility as it is away from the city. The complex is secured, thereby preventing locals from trespassing. As the virus is highly contagious, it is also important that the distance is not too far from the city hospitals in case of a medical emergency. A 24/7 ambulance is stationed to transport patients to nearby specialty hospitals if the need arises.
हमारे लिए सबसे बड़ा ये है कि हम इन्फेक्शियस सोर्स को अगर यहाँ ला भी रहे हैं तो वो बिल्कुल ही बाकी लोगों से अलग रहे हैं. उसके लिए हमने उस पूरे बिल्डिंग को चारों तरफ से सील कर दिया था. एक तरह का मतलब हमने एक जोन बना लिया था कि ये आपका रेड जोन है, ये येलो जोन है, ये ग्रीन जोन है.
There were Fauji Jawans which are not used to follow those practices which we follow in hospital settings, right? So we need to teach them from a very basic point of view.
As the urgent need for more quarantine centres was felt, private hospitality partners were also roped in. Frontline staff and housekeepers were sensitised. Trainings were conducted on guest handling as per the new SOPs.
So basically we train all the staff in terms of the infection prevention control practices, laundry management, food management, then identifying the symptoms, referral and follow-up.
First time we had, I clearly remember we had a meeting with NCDC and they discussed about all these things which was not very prevalent. There was some news coming from international market like China and all. We thought okay, this is not going to impact us so much. Maybe it will get resolved before it hits us.
To review the preparedness for prevention and management of COVID-19, Preeti Sudan, the Secretary of Health and Family Welfare, chairs a video conference with Chief Secretaries and DG Police of the 5 states bordering Nepal. As a part of surveillance at points of entry, teams from NCDC are deployed to review activities including screening at integrated checkposts and awareness generation to encourage self-reporting through Gram Sabha across Indo-Nepal border. It is one of the important international land touchpoints accessible by the general population from both countries. By 9th February, 1,818 flights and about 2 lakh passengers have been screened so far. There are about 9,500 persons under community surveillance in 32 states and union territories. 1,510 samples are tested, out of which 3 test positive. Surveillance of international COVID cases are literally being charted, so it can be shared to draft national advisories that are quickly changing with the developing situation. Tracking the shifting quagmire at the earliest is of utmost priority. Indians are advised to refrain from non-essential travel to the Republic of Korea, Iran, and Italy. People returning from these countries or travel history of the past 15 days are quarantined for 14 days. At the same time, efforts are being made to evacuate more Indians from China, Italy, Iran, and Japan. The frequency of cases being reported from across the world is fast increasing. On 2nd March, India confirms a 4th COVID-positive case. The businessman had returned from Europe on 24th February. After the test result, he was immediately shifted to Safdarjung Hospital. His contact tracing by IDSP confirms 6 epidemiologically linked cases in a cluster with high viral load in Agra. Leading the Central Rapid Response Team, the director of NCDC himself visits the site, a hotbed for the virus in the area. Wasting no time, NCDC designs the first containment zone, now popularly referred to as the Agra model.
The first cluster of COVID cases that was identified in India, which was in Agra, our EIS officers, along with the IDSP officers, with support from NCDC and the State Health Department, went there, set up a control room. They planned out a micro plan for doing a survey, systematic survey in the area where ILI cases, the influenza-like illness cases were identified. And any suspect was then referred for testing and contact tracing was done.
While the nation is being slowly engulfed by this contagious virus, Dr. Harshvardhan himself chairs video conferences to review surveillance, laboratory diagnosis, hospital preparedness, logistic management, capacity building, and risk communication. 8th March 2020. With the cases rising in countries including France, USA, and Spain, thermal screenings for travelers and airports and seaports from these countries, in addition to 12 other countries, are also set up. On 10th March, the reality struck. While a 76-year-old Saudi returnee coronavirus patient was battling for his life, NCDC officials were prepared to make a dead body disposal guidelines.
Death for anybody is 100%. Maybe it's a figure of 2%, 3% for the country, but for somebody it's 100%. At night around 10 o'clock, I received a call from somebody saying that, ma'am, ek death wala banana hai. In case there is a death, how do we manage it? So then all of us got into the picture. We were all at home and we started making the guidelines of dead body disposal.
On 11th March 2020, WHO declares COVID-19 outbreak a pandemic.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly.
On 12th March, doctors from NCDC leave for Italy to bring back samples from Indian nationals who are due to return. Passengers testing negative are evacuated thereafter.
Italy, during that time, that was one of the most affected country across the world. The moment I was, informed that I have to go to Italy, many friends, many relatives, they were saying that you will be going to some area that will cause problem, so you should not go. And I said that I love, because I said that no, this is my area, and I will, I have to walk, I have to go for it, and I feel that this is for the country.
Meanwhile, NCDC continuously reviews the situation of lockdowns across the world. As the country grapples with the new disease, NCDC, through its Integrated Disease Surveillance Program, or IDSP, was urgently mandated to perform contact tracing of those connected with the event.
The central government was very, very helpful, especially through NCDC, where we could track all our passengers and we would be segregating and isolating them, and they were put into the quarantine facilities, whether they were paid or they were the free services which were located in our government facilities.
Prime Minister Narendra Modi has announced a total nationwide lockdown.
On 25th of March 2020, India declares a nationwide lockdown.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
As the country stands still with the lockdown, the team at NCDC is working full swing, sweating it out for 24/7 to contain the pandemic. The central RRTs, with members from NCDC including epidemic intelligence service officers, public health specialists, and microbiologists, visit the states which have the maximum number of cases. From initial fears and confusion to a stage where scientists and medical fraternities have a better understanding of the disease, NCDC continues to fulfill its mandate to alert, train manpower, contain, and now mitigate the spread of COVID-19.
The staff and the officers of this institute were instrumental to take the responsibility and perform as frontline workers as and when required.
To get the swab test results for coronavirus within a couple of hours, NCDC acquired Cobus 6800. The Union Health Minister, Dr. Harshvardhan, dedicates the machine to the nation to help ramp up testing. The Cobus 6800 is capable of performing real-time polymerase chain reaction, or RT-PCR testing for COVID-19. The machine can test around 1,200 samples in 24 hours.
Now we can diagnose or test, more than 1,000 samples per day easily, with the manpower, and we can also use the same manpower we are also using, for the genome sequencing. So we are able to do much more, because the throughput is much more. So for diagnosis, yes, Cobus has really been a game changer.
With constant information, Health Ministry officials along with NCDC officials have been on their toes to disseminate updates and create awareness among the public. June 27. By now, Delhi has become one of the hotbeds of the raging pandemic. The Ministry of Home Affairs commissions NCDC to conduct serosurveillance. From June 27 to June 10, random blood samples of more than 20,000 people were taken to test for the antibodies to the COVID-19 virus.
We were given only 10 or 15 days maximum, wherein we have conceptualized a very scientifically, meticulously designed study to do the serosurveillance in the general community of Delhi. So it was a different kind of test which has to be done on the general population. It was a blood test. So there were a lot of issues which were different from the usual RT-PCR testing or rapid antigen testing.
High-level expert group committee consisting of Director of AIIMS, ICMR DG, and NCDC Director was constituted to extend support to the Delhi government.
NCDC has been the guiding institution for us right from the beginning of the COVID pandemic. It has been there for technical guidance whenever we needed some. in day-to-day management regarding COVID-19.
Amidst the pandemic, NCDC also observed its 111 Institute Day on July 30th. The Union Health Minister Dr. Harsh Vardhan used the occasion to take stock of the situation. As India battles the pandemic of our times, the National Centre for Disease Control is at the epicenter of how the virus is being fought on all fronts. Human history is manifested with pandemic diseases once in every while, and each time, the savagery has been to a greater degree. Once again, this outbreak ironically refutes mankind's false sense of conquering communicable diseases, leading us all to the catastrophic complexity of battling hunger and enduring crashing economies.
Human body and the biological science, they play a role. It is not a mathematical calculation, 2 plus 2, 4, or 4 plus 4, 8. It is not always, disease does not happen like that. So there are many interactions, many reactions which are happening in the animal world, in the wildlife world, in the human world. So many of our activities are by themselves creating some changes in the microbes and various other organisms. So, and human activities are making ourselves exposed to that. So if we are having in such a complex environment, it is really difficult to predict that what will happen. What you are saying that the system can be foolproof, I don't think, because disease happens inside human body, and you cannot put the floodgates that no, okay, you have put the checking at the airport, so nobody with the disease can enter. So this really doesn't happen. That is why you are having enormous checks.
And as the world races to find a vaccine and cure for the disease of the century, the Ministry of Health and Family Welfare is constantly tracking the pandemic of the century and continues its fight against the disease.